Hey guys, in this video I'm going to explain to you what's the best way to approach a phone call to online medical control. Medical control could be called for either RMA requesting medications or for discretionary orders. But also remember that you could use this resource for consultation of any type of circumstances where you're not sure how to proceed. No, don't be afraid to communicate the fact that you're not sure how to proceed. Because in medicine, not even the doctors know everything. I'll give you an example. I went to medical school. I graduated from medical school, and I read a lot of books on different topics. And almost every single topic and every single organ system says, quote unquote, well, that's what we think is going on, but we're not sure. So basically what I'm trying to say is that doctors definitely know a lot, and we're very knowledgeable, but at the same time, we do not know it all. So if an EMT or a paramedic calls you for guidance, you're not going to be looked down upon if what you're asking is prudent and within your scope of practice, and you're just a little bit confused on how to proceed. So remember, when calling, remember that no one knows it all, not even a doctor that's speaking to you that works for telemetry. And if they don't know it all with all the years of training and studying that they have, what makes you think that an EMT with 6 months of training or a paramedic with 1 to 2 years of training is supposed to know it all? Because a lot of times we're taught to think that we're supposed to know everything, but in reality, no one does. So don't ever hesitate to call telemetry with a situation where you're not too sure on how to proceed. And I'll give you an example of when this happened to me. For example, I had a patient that was suffering from eclampsia. So basically, she was pregnant, had a seizure. We gave the mag sulfate. The mag sulfate was supposed to work, but it didn't. So I was like, should I go into the seizure protocol? How would this medication affect the patient? Or how would it affect the fetus? I wasn't sure. So I called telemetry and I gave to them the situation, and they told me to proceed with giving midazolam. But had I not called and just transported the patient, maybe she would have had even more seizures, and it would have been an unfavorable outcome for her and the baby. But the medication helped stop the seizure, and that's because I wasn't afraid to call. The thing I would like to mention is the reason why I feel so comfortable calling telemetry is because I've called them so many different times. So my advice to you is, if you're uncomfortable, face your discomfort and speak to them every chance you get. Well, before you call, always remember that you're going to be using them as a resource, and when you speak, try to ooze politeness, assertiveness, professionalism, and efficiency through the phone. Easier said than done, but when you call, always remember that this is the demeanor, this is the posture that you want to take when calling online medical control. And when the person picks up, which is usually a medic, a paramedic with experience on the street, picks up the phone, and if for some reason you say something that's out of the ordinary, they're going to pick up on it immediately. It's kind of like a dog that smells fear on a person. So when you call, you have to be assertive. You have to show confidence. So if you're calling and you're stuttering, and you sound like you don't know what you're doing, they're gonna pick up on it, and they're gonna progress into calling other resources to see what's going on. Other resources could be a telemetry boss, supervisor from the fire department. It could be another ALS unit, and you don't want to be an ALS unit getting another ALS unit. You don't want to be an ALS unit getting an ALS unit called for backup because you're not sure on what to do, or the telemetry doctor didn't trust your patient care. So to avoid this, I would say, I guess, review your protocol. So a big problem with calling online medical control is that sometimes they make you second guess yourself. And to avoid this, all you have to do is just keep current with all of the events in EMS. Read your protocols often, and even read the protocol before calling. So if you're going to call for medical control options after a cardiac arrest, let's say, for example, then know that in in PEA, asystole, you do not give magnesium sulfate. Another thing is you got to know when to speak directly to the doctor. For example, if you have a tight asthmatic who is in status asthmaticus and you're getting ready to intubate this person, that telemetry medic picks up the phone. I'm like, my first thing is, hey, this is XYZ unit. I need to speak to the doctor because we have someone in imminent respiratory failure and we need to intubate him. Don't start like giving a rundown of the patient's name and the patient's demographic information to the medic, because this is the type of situation where you need to speak directly to the doctor. And I've noticed that's helped me a lot, because when I have these type of patients, I immediately tell that person I need to speak directly to the doctor, and I'm not afraid to do that. And there's been one or two instances where the telemetry medic or the triage medic in telemetry will try to like, hey, but what's going on? I'll tell them politely, you know what I mean? Because you don't also want to get into an argument with these people. Consider it like this: we are the egg and they are the brick. If we clash with them, we're the ones who's going to be fractured, not the brick. You know what I mean? So you also want to be polite and keep them happy, but at the same time, don't let them bully you around. Is one, they can't restrict you if what you're calling for is prudent. Two, no one knows it all. Three, the doctor who's picking up the phone most likely has less EMS experience than you do. And also, you got to remember that there's only one telemetry doctor for the entire city of New York. And guys, remember, telemetry's not there to hurt you. And when you call, be polite, be assertive, be respectful, be professional. Don't take it personal if the person on the other side of the phone is stressed out and having a bad day. Know your stuff. And the call should be a wham bam, thank you ma'am type of thing, where you're just calling to get what you need and you're hanging up right away. No beating around the bush, get straight to the point. And that's about it. I hope this video helps. Please share it with somebody that you believe could benefit from it. All right, peace.